Good evening, everyone, and welcome to the latest edition of the Rural Minds Connections webinar series. My name is Julie Lux, and I'm Vice President of Communications at Rural Minds. And we have a really important and I think fascinating subject to discuss this evening. We're talking about mental health challenges confronting youth in rural America. And we will meet our participants and get started with our discussion in just a moment. But first, the usual housekeeping. And this is one thing that some of you who've been on our seen our webinars before already know, but we do want to reiterate the fact that confidentiality is very important to us here. So aside from the smiling faces of our presenters, who you will see this evening during this presentation, none of the participants' likeness or names will be shown on the screen. So you will be in anonymity. However, that doesn't mean that you are off the hook, because we do want you to participate, and you can do so by sharing with us your questions. There's a Q&A tab at the bottom of the screen. So when you think of something that you would like to ask to the presenters, please feel free to jump in and type that in, and we will answer as many as we possibly can during this evening's presentation. But as I said, this evening we are talking about mental health challenges and how they relate to young people in rural America. And so the first person we are going to talk to this evening is Ashton Medlin. And Ashton she is someone who is confronting these challenges and helping to make things better in rural America. But those of you who might have seen a video that our founder Jeff Winton did along with Ashton, that was part of a series on USA Today. If you haven't seen the video, it is on the Rural Minds website, so please take a look at that. But right now, Ashton, welcome, and thank you so much for being with us tonight.
Thank you so much, Julie. So I just want to start by reiterating, like Julie said, my name is Ashton, and I am from a small town in North Carolina. It's called Roxborough. So I kind of just want to start with talking about my own personal experience growing up in like rural America. So rural America for me is the small town where there's a group of people and you just know everyone. It's a community that's small, but it doesn't feel small because you're living in the middle of nowhere. And growing up for me, there was definitely some pros and cons when it came to living in such a small town. Of course, I loved the sense of community. I loved that if we ever needed anything, myself or my family, we had our neighbors to turn to, we had our community to back us up. But there was also the issue that came with the small town of the problem that everyone knew everything. And so if you were going through something, if you were having a hard time, it wasn't just you that was aware of it, it was the entire community. And because of that, I started to notice that a lot of kids, especially those in my community, we kind of kept what we were feeling, what we were thinking, all of that stuff to ourselves. You don't really want everyone in your business, especially when it's not the best business of yourself, the best version. And so that's kind of how I grew up. There was one organization, though, that I first started attending when I was 9. It's called The Grange. And this kind of helped me break out of that small town, that reserved box that I grew out of. And I started going to a summer camp when I was 9 years old. Through this summer camp, I was given numerous opportunities, not just to make new friends across the state, but also to grow in my leadership skills, in my community service, and just in general become like the outgoing person that I knew I was. And I was able to make the youth leadership team in North Carolina, which for us, that's a team where teenagers can apply and they can learn to hone their leadership skills, not just through advocation for different things, but also through interacting with teens our age across the state. And it was this leadership team that really allowed me to come out of my shell and start expressing myself in a way that I wasn't really not allowed, but I wasn't really comfortable with doing growing up in such like a small community. I was on this team up until my freshman year of college, and I got accepted into the University of North Carolina at Chapel Hill, which is a large D1 school. It's the biggest school, not the biggest school in North Carolina, but it's one of the bigger ones. And so all of a sudden, I was packing up my stuff, moving an hour away from home from this very small town where I knew every person in my graduating class to a place where my chemistry 101 lecture in the morning was the same size as my graduating class. And so this transition, to put it in very simple terms, was very difficult for me. I suddenly went from being the smart kid, not having to study, to being one of the smart kids. I was valedictorian of high school, and suddenly every person at UNC was valedictorian of their high school. And I think this change was especially difficult for me because I had grown up learning that if something was bothering me, I just kind of kept it inside. I cried about it in my room by myself. It was something that I didn't really express with other people. And so all of a sudden, I'm at this huge college. I don't really know anyone because no one else came from my high school. It was just me. And I was struggling. I was struggling in my classes. I was struggling to make friends. And I was struggling with the fact that I no longer lived in this sheltered small community where I knew everyone had my back. And through this struggle, I relied heavily on the Grange and that organization and the friends I had there because they were the one group that I knew I could be myself. I could tell them this stuff. And through them, I was able to make my freshman year exactly what I wanted it to be. And I'm very lucky for that. Unfortunately, though, freshman year was also kind of a turning point for me at least. And although it wasn't at the most, at the closest level that it could be, it still really impacted me. And it was through the suicide of a classmate of mine that lived on the same floor of my dorm. And when this happened, I didn't know him. I had never really interacted with him. But the thing that stood out most to me was the similarities between like our upbringings. He was in the same classes as me. He lived on the same floor as me. He was from a small town just like me. And I think that realization that we were on the same path originally and somehow we ended up in two completely different outcomes because I had a system that I was able to rely on, the National Grange, versus he didn't really have a system. He had grown up learning that you bottle all this up, you don't talk about it, you don't express it. And it just really impacted me a lot. And because of that, I felt moved to write a speech for our National Grange competition, our public speaking competition. And through the speech, I had been struggling because I knew I wanted to write one, but I didn't really know what to talk about. And then this event happened, and the words just flowed on the paper. I remember sitting down and typing it in probably 10 minutes. And I put everything that I had been thinking about my freshman year, about my life, about what path I was going to go on, all my insecurities about not being the smartest, about not knowing what I was going to do with my life, about my self-worth. I put everything on that paper and then I went to the National Grange Convention that following year and I performed it. And in front of all my friends, in front of all the strangers, in front of the entire organization that I had grown up loving, I was able to show them a part of myself that I wasn't really sure I would ever be able to express, especially with how I grew up. And I actually won first place for that speech. And I thought at first, like, okay, that was it. Like, that was what I did, and it's great. I continued college. But little did I know that was actually the very beginning of my mental health advocacy journey. Because of that speech, I was able to apply for the national leadership team and I won it. So I became the youth national ambassador. So I was able to not only travel within my own state to talk about issues like this and advocate for that, but I was able to travel across the nation. And it even grew even more because a member of the organization I was in, the Grange, they saw my speech and they just really felt that it needed to be shared with more people. And so when an opportunity came up to partner with Rural Minds and USA Today and Pfizer to create an article and a video about rural mental health in America, especially in like adolescents, they recommended me and they said, "Hey, Ashton, we have this opportunity. If you feel like sharing your story, would you like to do this?" And from there, it kind of just snowballed. And I didn't realize quite how big this opportunity was until it was actually happening. I remember going on all these Zooms and them just saying, like, talk, like, go ahead and tell us what you think. And I remember being like, I'm no expert. I didn't go through like a severe trauma myself that could, cause all of this. But I remember just speaking from the heart and talking more and more about how important I felt this was and my experience growing up and how I thought that this was something that needed to be shared, not just with the Grange or not just with Rural Minds, but with the entire like nation. And through that, last summer, we were able to create our video and our article and it went amazing. We spent 2 days filming and like interviewing, and we talked about everything. We talked about my small town, we talked about my experiences, but I was also able to talk about issues that I had noticed. Specifically, social media was such a big one for me. And I remember telling them, like, we have to put this in there because I know how easy it is, especially in today's age, for kids to look on a screen, see everyone else having this perfect life, these perfect moments, and thinking, wow, my life isn't like that. And I just wish that it was. I wish I was good enough to have this many friends, to have this many cool experiences. When the reality is, that's what everyone is doing. The best moments of your life are what we put on social media. No one sees the behind the scenes. No one sees the struggles. No one sees you laying in bed at night scrolling through everything. And so I really wanted that to be out in the video. And thanks to Rural Minds and USA Today and Pfizer, we were really able to make that come true. And so it's been about a year since the article and video have been filmed. We filmed it last summer, and the impact is way more than I could have ever imagined. In my small town, Roxborough, like I said, everyone has each other's backs. Well, one way that they had my back is they showed that video to all of our middle schools. They showed it to our high school, all of our classes. And I had people that I had talked to maybe once or twice in my life messaging me and saying, "You don't know what this means for us. My child needed to hear this." They came to me and they said, "Watch this video." And to know that I had that impact on my community, especially when I had felt like I wasn't able to talk about that with fear of judgment in that setting, it was just insane. I realized that even though my community is small and even though you don't want everyone to know all of your business, it's not always a bad thing to open up to talk to people. It's something that has to be done. And once you do it, it could almost inspire other kids to open up and talk to that. And I
I
really found out, oh, yeah, go ahead.
No, I was going to say because I'm the timekeeper, Ashton, and I'm the one who
Yeah,
has to keep the trains running on time. And I think we will hear from you more later during the Q&A. But
awesome.
I think the one thing that's so remarkable is that one, really, I think you could call it act of bravery on your part to write that speech and to present it has really opened up so many opportunities for you. So I would love to talk to you more, but we need to move forward. But don't go away because we are going to get back to the Q&A a little bit later and hear more from you. But at this point, we're going to move on to our next guest who has joined us, and we'll see you in a bit. Ashton, thank you again for sharing your very brave story and how what wonderful things came of that experience that you had. But next, I think that Dr. Eric Arzubi is with us now. Dr. Arzubi, if you would join us, please. He is going to talk. We have talked to Ashton and we've heard a little bit about what her personal story was like, but now we're going to hear from your side, which is the professional side, doctor. So I'm going to turn the program over to you and tell us a little bit about yourself, if you would please, and then tell us how what role you play in this very important subject of young people and mental health in rural areas.
Sure. Thanks for having me. And yeah, it's great to be here. My name is Dr. Eric Arzubi. I'm a child and adolescent psychiatrist. I'm based in Montana. Actually, today, talking to you out of Pocatello, Idaho, and traveling here because, again, going to another state where there's where there's pretty significant rural need for support. So I'm proud to be here. So I've been in Montana since 2013. This is a second career for me. In the 90s, I actually worked on Wall Street. Now, don't hang up. Don't hold that against me.
Yeah.
But I worked in New York City and Wall Street for a number of years until I really started reflecting on what I wanted to do with myself and find something that really gave me more meaning. And I kept thinking about my pediatrician growing up in Vermont. So I was born and raised in a rural state, ended up in kind of the middle of my life in cities, and now back in another rural place in Montana. So I went back to school, did my training, finished my training as a child and adolescent psychiatrist, and moved out to Montana, and been in Montana ever since. And since arriving in Montana, I originally moved to Montana because I thought, it's beautiful. It'd be a great place to raise a family. I was married at the time. I had 2 daughters, and yes, to all of those things. But what I didn't know was really, and this is interesting. I went to a pretty solid training program, but they don't tell you about the geographic differences in sort of access to mental health care and how it affects overall whole person outcomes, really. So, I was trained in a pretty urban area, moved out to Montana, and then found out Montana has been posting among the worst suicide rates in the country for some 40 years. In fact, Alaska, Wyoming, and Montana are the 3 states with the highest suicide rates in the country. And they were also the 3 out of the 4 states that did not have a psychiatry training program. And so when I joined a health system in Montana called Billings Clinic, about a year there, I became chair of the department and really took it upon myself to try to figure out what the heck is going on here. How come it's so dire, and I don't see the needle moving on any of this? And so worked really hard to make as many changes as I can, at least locally, to try to improve access to care. So launched Montana's first psychiatry residency training program. I opened up Montana's first emergency psychiatry program, sorry. And then in 2019, I left because I was really passionate about wanting to make telehealth more widely available. If you look at Montana, well, I wish we were a crowd, because I'd be pulling people out and asking questions, but I'm gonna do it here and pretend. So Montana actually fits 27 Connecticut's. Think about this. If anybody look at a map, you look at there's Connecticut. Connecticut has about 3.5 million people. Montana fits 27 Connecticut's and has less than a third of the population of Connecticut. And as you can imagine, with no really psychiatry training program, and there was no medical school in Montana until about 3 years ago, it was difficult. As beautiful as Montana is, it was beautiful. It was very difficult to attract psychiatrists into Montana. And so Montana, along with Idaho, Alaska, Wyoming, are states that have among the fewest psychiatrists per capita. And things like that, the access to care are what is one of the issues that makes the mental health outcomes in rural America so challenging. You look at the distance from one corner of Montana to the opposite corner, it's the same distance as it is from Chicago to Washington, D.C. And so you can imagine, when I was having patients traveling 4 or 5 hours for a half-hour visit, it just didn't make a lot of sense to me. They were, parents, for example, were taking a day off from work, pulling the kids out of school, driving, 4 or 5 hours to come down and see me for a half-hour visit. That's onerous. It's expensive. It creates a lot of barriers. And those are among the many, many barriers that people in rural communities face when it comes to accessing high-quality care. Some people live in more urban areas where you're closer to, for example, academic medical centers. I don't know if you're in big cities in California and Chicago, even Utah, Salt Lake City, you're closer to academic medical centers where psychiatrists are trained. You have at least closer access to, highly qualified and highly trained psychiatrists. But what about the communities that don't have any of that nearby? Is it fair for these rural communities to expect substandard care or less care than they would access in other parts of the country? In other words, should geography in your zip code determine how you access or the quality of mental health care that you're able to access? I don't think so. And there are a number of other things, right? So some of you may have heard of a term called social determinants of health. And social determinants of health are really the parts of our experience in society that are not related to the healthcare system. In other words, it turns out your access to medical care only determines about 10 to 20% of your overall healthcare outcomes. The rest has to do with the economy, your community, in terms of access to services, educational opportunities, housing opportunities, being exposed to traumatic experience in childhood, stressors that are related to your environment. For example, think about farmers and ranchers these days. Farming and ranching is a brutally difficult uh, uh, occupation to be in, even at baseline. Right? Think about all the variables that are involved. The markets for commodities, right? The price of wheat or soybeans going up and down, up and down, up and down. Then, you know, shifts and changes in weather that really affect the way crops are being grown. Then throw in kind of all this debate about, for example, this year happens to be about tariffs, but last year and the year before, there's always something going on that's affecting the market and the economy of agriculture. And so farmers have an incredibly difficult time navigating these economic waters and their ability to kind of provide. And so that kind of stress, ongoing stress, is just a small example of some of the stresses that are faced by people living in rural communities. Go
Professor,
ahead, Julie.
I was going to ask you a question just because it's something that Rural Minds has been looking at recently, and that's the whole idea of isolation. You were talking about how, you could put a lot of Connecticut's into Montana. Does that play into it that the people who are living in this area may not have the social interaction that people do when they live in maybe a more populous area?
So yes, absolutely, right. The sense of isolation can be much more extreme in some of these small rural communities. I would argue, I would argue that over time, and interestingly, in this time of social media, strangely, people are becoming more and more isolated. Right, the rates of loneliness are going up no matter where you live. But yes, there's also, there the cultures are different, right? So, for example, if you have depression in New York City, that experience is very different than having depression in a small town in Wyoming. It's different because you have different resources, different types of support. You have, in terms of your access to care, right? There are a lot fewer options when it comes to getting access to care in that small town in Wyoming. So, what's interesting but also true is major depressive disorder. It's the same. You diagnose it the same way in both communities, but the outcomes and the experience are both very, very different, which means we really need to think about how we address mental health and behavioral health. And when I think about behavioral health and mental health, I think about both psychiatric disorders as well as substance use disorders, because I'm not going to treat those separately. Those two overlap and are very closely related, but the outcomes can be very different based on kind of where you live, your background, how your family talks about things, if that makes sense. Oh, you're on mute, Julie.
I was just thinking while you were talking that is the stigma greater also sometimes in rural communities? Have we not quite we hear that quite often that we haven't broken through that stigma in all communities, that it's even rural communities, it's even okay to talk about the fact that you're dealing with something that's more of a mental challenge.
So stigma, yeah, absolutely. Stigma is everywhere. Stigma in rural communities, I would say it takes on a different flavor. I don't know that I'm gonna say it's better or worse, more severe or not. It's different. The reason I'm saying this is, look, having been in Montana now for 12 years, I'm seeing at least the conversation shift. Why? Because in the media, in Montana, sadly, the suicide rate is constantly in the headlines. We have a crisis. We have a crisis. We have a mental health crisis. And so what's happening is it's definitely more top of mind now. It's becoming a little bit less problematic to talk about because I would, this is kind of a strange thing about Montana and I think rural communities in general is everybody knows someone who's completed suicide. It's again, yes, smaller population, but also it happens a lot. And so people know people who have completed suicide. And I just had not lived in a place where that was true in the past. And so I think it's affected people so much more often, is very deeply. And so I think trying to get away from that conversation is becoming more difficult. So hopefully we can use that as an opportunity actually to make it an easier conversation to have.
We're talking about, excuse me, about young people this evening. Are the mental health challenges for young people living in rural communities different? Are there different challenges that they might be experiencing? I know Ashton was telling us earlier about coming from a very small community and then going to the huge university where things were very different, in her life. Is that the case? Do you find that for young people in rural communities, the challenges are different?
Yes. Again, like I said, they're different because again, what I want to remind everyone is like there are cultural differences that I think are important to always keep in mind. And just a couple of the quick comments around that. Like for example, when I think of Montana, Montana has seven Native American tribes. Seven Native American reservations, 11 tribes. Top five when it comes to military veteran population per capita. Alaska, for example, is number one when it comes to military veterans, number one when it comes to Native Americans per capita. And so you have a mix of different cultures that you don't see and communities who have been vulnerable even across generations, right? That you may not see in other parts. So the challenges are different and the culture is different. When it comes to youth, it's as Ashton was mentioning, the difference that she saw when even just moving an hour away, going from her high school graduating class to chemistry 101, I would, again, I've seen, I've seen some communities in Montana where, several grades are in one classroom, right? So that still happens. For example, football teams in Montana sometimes play 6-on-6 because they can't get enough people. So you actually have people playing with smaller teams. You have, in terms of schools, you have they have to have these cooperatives to share staff. So, for example, you'd have what are typically would be, because of geography, different school districts actually have to share a nurse. They have to share a school counselor. They have to share a special education teacher. So if, when I was in more populated American communities, you could kind of try and make some noise and say, well, my kid needs a, special education service or a special education evaluation. I need to talk to a psychologist. And that doesn't, you don't have the resources in these small communities. So imagine you have a child with dyslexia and ADHD, let's say, in a town of, I don't know, 2,000 people, not a school psychologist or special education teacher to be found. You want to hold the town or the school district accountable to get services, but where? Right? And so the challenge is, right? So again, I mean, the look, 50% of mental health diagnoses tend to emerge by the time somebody's 25 years old, right? Before age 18, almost 50% of people have a diagnosable condition. I'm not saying everybody needs medications or everybody needs to be going to a psychiatrist. That's not what I'm saying. But I'm saying the vulnerability to some of these mental health challenges happen early, and the outcomes have a lot to do with where you live. And so schools, right? Schools are where people tend to spend most of their time when before the age of 17, 18 years old. And so if that school may have some very kind, loving teachers, but if it doesn't have the services that, many people who maybe don't live in such small communities have have kind of grown to be accustomed to having. Imagine what that's like. Imagine you're a mom who has a child with severe anxiety who can't make it through the school day because that child would rather be staying at home. What kind of resources do you have in those classrooms to be able to help that child navigate the school day and then prepare that child maybe to one day go to college? So, a lot of sort of these community supports or community systems that tend to be supportive are very, very different. They're smaller. They're under resourced in many, many small communities, which again lead to these more difficult and more challenging outcomes. You know, one thing to keep in mind is we all live in systems, and with children in particular, that's true, right? So if your child is born into a family system and is dependent upon how that family system is functioning and working, and that family system lives within a community system, right? And that child is goes from one system to another, goes from the family system out to the school system, back into the family system. May need to go to the healthcare system, right? And the government's a whole nother system, right? So if you understand that we're all navigating systems, children in particular are bouncing between these systems, and if these systems are struggling, like for example, the school system doesn't have the resources it needs, the health system doesn't have the resources or access to mental health professionals, and you have a vulnerable child within maybe even a vulnerable family system, think about the challenges that those parents face trying to help that child navigate getting to age 18 and trying to become an independent, thriving adult, if that makes sense.
It does, absolutely. I have a couple questions here. Before we get to that, what can we do? What can we do to help this situation?
Sure. And what I'll do also is if people, I know there's this Q&A button here, and if
Yes.
people have kind of questions or want to throw something out there, please go ahead, because I'd rather, and I know I've been kind of talking at you guys here for a little bit and I could talk for hours, but I'd rather people get engaged.
We've got stuff for you.
Great. So what can people do? So step one is this, like have this conversation and make people aware of what's actually happening, right? You have basically 20% of the American population is in, I think that's the number, is like in a, it's kind of in a rural area. So that's a big proportion of the population that is, and I know these days it's weird or people get uncomfortable talking about equity. Well, it is what it is. I don't care. There's a health equity issue when it comes to rural communities not having equitable access to high quality care, especially when it comes to mental health services. And if you pay attention to what I was saying before, it's the same is true for having access to equitable school resources that affect ultimate mental health, educational, and behavioral health outcomes. If that makes some sense. There's a it looks like there's a question.
But
Sorry.
no, go ahead. I mean,
No. So it looks like I don't know. So
them
is
or-
Frontier?
Oh,
what-
let's go. I wanted to go back because we had one person that was asking about how how with the programs that you deal with specifically, doctor, how are you making sure that those programs are relevant to the diverse experiences of rural youth?
So, so a couple of things. One of the interesting things in delivering mental health care in rural settings is you got to be creative. You got to think outside the box. Our mental health professionals are not trained to think this way, and it's nobody's fault other than the training. The training environment is just not wired to do this well. So like I said, I went to a great training program. Nobody taught me how to. And nobody said, "Hey, Eric, by the way, this is how you get high quality mental health care services to rural populations that are really hard to reach." Nobody does that. Also, when people publish, when mental health professionals, academicians publish papers, there are these beautiful papers that can that show great outcomes in these academic settings, but are almost impossible to translate into real world rural settings unless you live 10 blocks away from an academic center. So we have to absolutely rethink how we're training mental health professionals and healthcare leaders in general to be able to push out and scale high quality programs and high quality mental health programs, no matter where people live.
Okay.
Because again, if we're not designing for scale, it's going to break down as soon as we try to implement one of these programs. So again, having conversations like this, pushing researchers to not only think about outcomes in an academic center, but think about real world interventions that have real world impacts. It's not going to be enough anymore, and nor should it have ever been enough to crank out a research paper that's only based on living near an academic center. So those are some of the things I'm thinking about. Obviously, advocacy is important, and like doing the work that you all are doing. I think developing good relationships. Look, one of the cool things about mental health is that it's a bipartisan issue. I live in Montana. I came from Vermont, which tends to be purple, blue, depends on the day. Lived in cities that tend to be more blue. Now live in Montana, that's becoming more red. I don't care. Like, I really don't care. It has to do with, mental health is a bipartisan issue. Both sides have, 10 different reasons why they think it's important to their communities. So let's build on that. Let's absolutely build on that and ride that wave of support to actually get some things done. Anyway, I could go on, but I'm going to pause there, Julie, because I'm guessing you have other questions.
Oh, no, that's great. And yeah, actually, we have very lively discussion going on, a lot of good questions, but let's talk about this one because we hear about it all the time. What about telehealth? How does that come into play and can that help to ease some of this burden?
Sure, absolutely. So, a couple of things that, Montana was actually one of the pioneers of telehealth. Montana had been doing telemedicine since the early 90s. This is back when you still had to use these big, expensive cameras. When I arrived and actually and some of you may already know this, but one of the earliest adopters of telemedicine was actually the VA, doing this kind of worldwide with veterans. I arrived in Montana in 2013 and immediately started delivering care using telemedicine equipment. Montana, because its policymakers for several decades have known that there's a challenge, did some really good things to make telemedicine easy to implement in Montana, or easier, let's say. So that's what we got to be doing in all states, and I would argue every single state in the United States, at the very least, the rural states. Then there are questions like, and I remember before COVID, people were really hesitant about telemedicine. Even my psychiatry colleagues would wonder, like, it's not the same. I'm like, stop. It is arrogant to say that it's not the same. And here's what I mean. You don't pick in-person versus telehealth. You pick telehealth versus the alternative, which is often nothing.
Mm-hmm.
So I am not going to compare telemedicine to in-person care if most communities in rural settings have no option of in-person care. Am I going to wait and try to train more and more psychiatrists, therapists, counselors, psychologists to be able to go put them out there? In the meantime, we're going to pull back on telehealth. That is absolutely unethical in my eyes. So telemedicine is a tool, right? You still need to find great psychiatrists, great nurse practitioners, great therapists to deliver care, but it is a tool to be able to scale access to care. But again, we need to be doing this thoughtfully. Just by flipping a switch and just turning on a screen doesn't mean you're solving problems. It's much more complicated than that, but it's a powerful tool, and if deployed thoughtfully, can solve a lot of problems.
That brings up an interesting point to segue. You segued very nicely into another question, Doctor, and that is, what advice would you give to a young person who wants to get into mental health? So a younger person who would like to be part of the solution and become a psychiatrist or a psychologist. What would be the best thing for them to, and particularly working in rural communities, what would be the best thing for them to do?
I didn't finish all my psychiatry training until I was 44. And I didn't figure out that this was a topic I was passionate about until, a couple of years after that. So I'm probably the wrong person to ask, because I'll probably put them down the road and they'll end up on Wall Street again. I'm kidding. I think, I think the most important thing for a young person is really, step one, start keep an open mind and try to discover and uncover what is your why. What makes you tick in the morning when you wake up? What is it you think about? What is it that really drives you? And really, focus on that. And if it continues to be doing something in this space, I think that's a wonderful thing. It's a beautiful thing, and I think we need more people like that. What's nice is getting involved in mental health. There's so many different ways to do that. You can become a psychiatrist, a psychologist, a social worker, a licensed clinical professional counselor. You can get involved you can become a pharmacist that works in a rural setting. There's so many different ways to get involved. I think so any of that would be awesome. And, start by learning about that now, do you take a psychology class, abnormal or normal psychology, either one, doesn't matter. Just start learning about people's thoughts, behaviors, how people think, what works, what doesn't work. And then the other thing is we desperately need more effective leaders in healthcare and especially in mental health, beyond just clinicians, right? Because we can have lots of great clinicians, but if we have crappy leadership in healthcare organizations or in kind of larger communities, those resources will be deployed in a way that's not effective. So again, I absolutely encourage people to get involved in clinical work, but make sure that we're training also the leaders of tomorrow when it comes to mental health care, healthcare in general, and understanding the needs of rural patients. Because the only people I want to work for that are people who put patients first, the community first, and that's the only way we're really going to solve this problem.
Well, speaking of patients and speaking particularly of patients and young people and what people can do to help, Rural Minds has a new program that we are working on right now. And the young woman who is leading that, our own Adriel McMahon, is with us. And Doctor, don't go away because we're going to have some questions in a little bit. But right now, we'd like to turn it over to you, Adriel, to tell us about the Rural Minds program.
Yes, hi, my name is Adrielle. I'm from Elkmont, Alabama, and I serve as the lead on the Rural Teen and Young Adult Mental Health Program. I also work on social media for Rural Minds, so helping us reach and connect with people in meaningful ways online. So I'm excited to share a brief overview of this new initiative, a pilot program we're launching in New York and Pennsylvania that's focused specifically on being an informed response to the mental health crisis that's confronting rural youth. As many of you know, mental illness can carry a deep stigma in rural areas. There's often a cultural pressure to handle things on your own, kind of a tough it out mentality, and that mindset can make asking for help feel like a failure. Combining that with limited access to care, isolation, spotty internet, it becomes clear just how hard it is for rural youth to get the support that they're needing. So this program was really created to address that reality. What makes it especially meaningful is that it's being built with the rural youth and not just for them. So this program structure, content, delivery, it's all being shaped directly by a youth advisory committee made up of young people from 4-H, FFA, National Grange, and they're all living in rural New York and Pennsylvania, which is the area where the pilot will be taking off from. And I've got to say, it's just been such a privilege working with them. These students, they're passionate, insightful, incredibly driven to create change in these communities. And we've already learned so much from them. I mean, about what works, what doesn't, what they wish they had when they or their friends were struggling in these areas. So the program really just focuses on three main pillars: education, really delivering that relevant and culturally appropriate mental health resource for them, and then community engagement, building that local support through partnerships with the schools, the churches, and the youth organizations like FFA and 4-H. And then digital outreach, truly meeting them where they're at through TikTok, YouTube, Instagram, with that short form content that they respond so well to, peer stories, mental health tips, things of that nature. So we're really working with the goal of making these youth and young adults feel confident and equipped to have these conversations in their schools, their homes, their friend groups, with their teachers, their friends, their parents. And this New York and Pennsylvania pilot is truly the first step. The feedback we gather will help us shape that national rollout and help us build something truly sustainable. And I think at the heart of this is a simple but really powerful goal to reduce the stigma, reduce suicide, and improve mental health overall for rural teens and young adults. We believe that the real change happens when young people are empowered to lead it, And I think this program is all about really helping them do just that. So thank you, Julie.
And it's very exciting, Adriel, and thank you to you and to all the people on your task force that are making this a reality with when does the pilot program kick off?
We're still working on framework and having these committee meetings with all the students and the teachers. So we don't have an official date yet, but it is moving forward at a great rate. We're really happy with the responses that we've been getting. So yeah, it's been going really well.
Awesome. Stay tuned. More, I'm sure, on the Rural Minds website
Yes.
as plans expand. And since Adriel is very involved in that as well, she's a great contributor to all the good work done at Rural Minds. But
Thank
with
you.
that, let's ask Ashton and the doctor, you said you like professor, so the good professor to join.
No. I like Eric. I don't know.
Okay,
I don't know.
okay.
I did not say call me professor. I said call me Eric or Dr. Azubi, not professor.
Okay, all right, doctor. Thank you. My mother trained me. I have to say doctor. So she trained me well many years ago. But we do have some questions and wanted to get everyone involved here for the last few minutes to answer some of these. And I'm going to open this one up to the group because I think it's relevant to all of you. But someone asked, how do you feel about peer support as an option for mental wellness support?
I can, if semi-clinical question, I'm happy to jump in, and anybody else want to jump in, please do. But so one of the things I think we don't do enough here in the United States, and it varies from state to state, is using non-licensed professionals to provide support. So peer support specialists are people with lived experience who have had extra training that will work with other people affected by mental illness and provide support like just being there, providing community, connecting them to services, sharing about their own experiences, navigating the system. So peer supports have a lot of research that demonstrate they can be effective, and is one way to scale access to more supports in rural America. Another one can be community health workers. Some states are using community health workers and reimbursing for that, and some states are reimbursing for peer support specialists as well. So that's a big fat yes from me.
Yeah, I'll just really quick add on to that. Yeah, I think it's absolutely a great solution, especially for smaller communities that maybe don't have like the funding or the resources to hire like a professional um, like psychologist or something. But I think it would be really helpful because it gives students an opportunity, even if they aren't ready to completely open up, they just know that they have someone in their corner who's there for them and ready to support them no matter what. And sometimes that can really help like start the journey and start the conversation.
Very good. Thank you. Thank you both. What about are there opportunities? You talked about peer support, but there's a lot of people probably of all ages that think that it's important to help young people. Are there options out there for people to volunteer in their own local communities?
Ashton, you want to go? Or you want to start? You tell me.
I can try to answer this the best that I know. I am not a professional and I am not a doctor or a professor, but I'm in college, and so through my college we have different clubs that work with high schoolers and even middle schools that do this kind of stuff. And so I was able to get involved with a couple different programs through my college, and we found out that another great way to do that was to extend that kind of club to the high schools. So I think that could be a way for like younger students to get involved is what we do is basically we go and we talk about stuff and we talk about our own experiences, because sometimes hearing someone else talk about it can kind of inspire you to talk about it. And so that's how I've kind of gotten involved through like my community, is I've done it through like my school clubs and stuff like that.
So it depends. It depends on your community, where you live, what kind of programs are available, or you can start your own, right, and get creative. So it depends on how ambitious you are. Being a mentor for a youth, that could be awesome. There are also many states have court-appointed special advocates that it's called the CASA program, where you, with some training, you can go and be a support for a child who's been exposed to abuse or neglect. So that's another volunteer program. If your state has, if you're someone with lived mental health or mental illness experience, you can be a peer advocate, peer support specialist. If not, look around, see if people are looking for community health workers. I mean, the other place too is if you're into advocacy at the policy level, do that. Go testify in your local Congress at the state level. Talk to your representative at the national level. Like, just get involved. Like, it's shockingly easy to get involved and start influencing policy.
And it sounds like from what you all are saying, lots of different ways. So different ways that fit different individuals. And I'd like to give a plug here for the Rural Minds mental health resilience program, which is all online on our website. And part of that is actually I guess you could call it a seminar in a box or a program in a box, where people can put together a program that they can give in their own local community. So no matter what age group it's for, all the resources are there to give to put on a program, help educate people in your own community. All that material and lots more is available on the Rural Minds website, and it is absolutely free. Going back to our questions here, someone was asking, have you observed any impact of religion and openness or closedness to seeking mental health services? And this is in response, they asked in response to the risk of suicide.
So it's a hard one to generalize. I would say, it's interesting. So religion and spirituality has been studied and is actually a protective factor when it comes to mental health. Kind of giving people a sense of belonging. In a lot of rural communities, right, being part of the church, I think, is a real protective factor if part of a community. Now, if your religion happens to kind of reinforce stigma around mental illness, and that kind of it gets a little bit extreme, and not having sort of a lot of kind of grace or forgiveness for again struggling or having attempted suicide and that sort of thing, yeah, that can be a problem. But I've not seen a lot of that. I've seen more people really leaning into using their church as a source of support, a source of community. And again, in at least the areas where I'm we're doing our work, I've seen that be a positive, not negative. And also, you actually have a lot of licensed therapists that are kind of Christian informed. If you're talking, like, again, you can probably do it for any religion, but a lot of people like that, right? So somebody struggling with anxiety disorder is a kind of very devout Christian, and it's kind of teetering, like, oh my God, is it a religious thing? Is this it doesn't matter. Just talk to somebody, and if you have somebody from your own faith that's willing to talk to you, great, use it.
Wonderful. As I'd like to ask each one of you as we get ready to wrap up here, and Ashton, I'm going to start with you. Speaking to other young people in rural areas, ones that maybe grew up like you did and have had similar experiences, what would you say to young people that are struggling?
I would basically say to just start the conversation, even if you're not ready to necessarily talk about your own inner struggles or your own like problems. Even just bringing up the topic to someone that you trust, even if it's a friend, a parent, a family member, a teacher, just starting the conversation, because we all know that it's a difficult one. We all know it's awkward, and we all know that sometimes it's not always the easiest thing to talk about. But once you start talking about it, it becomes more of the normal. And there's nothing wrong with talking about it. There's nothing wrong with having problems going on. And I think the more we talk about it, the more it will become normalized, because it is a normal thing and it's something that has to be talked about if it's going to change.
Awesome. Eric, parting thoughts.
So, sure. So when I was 30 years old, I was diagnosed with a generalized anxiety disorder. I still take Lexapro. I go to therapy when I can, and I talk about it when I can. And so I have no again, if I had a broken leg, I'd talk about that. Not that I'm sitting here showing off like all the different pains I have, but like why not talk about my anxiety if I can talk about my broken leg, right? So so I try to do that just to kind of when I can reset the conversation and be like, oh wow, this shrink is willing to talk about his anxiety. Yeah, why not? And really kind of doubling down on what Ashton said is find a trusted adult. Find a trusted adult. Start there. Find a trusted adult. Uh, don't go to TikTok for your mental health services. And what's nice is more and more there are actually more digital tools that are going to be coming out when it comes to getting access to. And I'm not saying digital tools are the end all be all, but what if you have a 13-year-old who's struggling with severe depression and parents, for some reason, don't believe it or don't want to believe it, and the child needs support? So, number one, hopefully that child can access a trusted adult. Number two, if they go online and can find really proven ways to get some better help, like why not? And there's also a crisis text line I really want to plug. It's 741-741. It's a very easy, just text there, help or anxiety or something, and the conversation starts. It's a live human on the other end. I would recommend people use that too.
And that number again,
741, 741.
741, easy to
Yep.
remember. Awesome. Well, thank you, Dr. Erica Zuby, for your expertise and your insights, and Ashton Medlin as well, and Adriel McMahon. We are very excited to hear more about the Rural Minds Rural Youth Program as it comes into fruition. But we appreciate the time of all of our good folks who are watching tonight. I wish we had time. We could go on for a long time. We have a lot of good questions, but we tried to get to as many of them as we could in the time allowed. I want to remind people quickly as we close here that at the end of this presentation, you will be receiving a survey. We really appreciate it if you would take just a couple of minutes and respond, because the information that you provide in those surveys helps us to determine some of the subject matter that we will be using in other Rural Minds presentations and in these webinars in the future. And finally, again, ruralminds.org is our website. For those of you who are not familiar with the organization, we encourage you to look at the website. There's a lot of, as I mentioned earlier, many resources available, all free of charge. And we greatly appreciate the time and expertise of our guests and the time of our participants as well, because your time is precious. Thank you.